Hi everyone, it's Carrie from Beginner2002. Just got home from the hockey game and thought I would create a quick video clip for you about acid-base balance, or as I like to call it, acid-alkaline balance. And the reason that I like to call it that is because this is how I remember what is what. So when we look at acid, I remember that it's 4 letters. When we look at alkaline, it's more letters, so we know that acid is a lower number and alkaline is a higher number. So you can see that on your screen here. So your lower number, so acid only has 4 letters, alkaline, 1, 2, 3, 4, 5, 6, whatever. It's a lot more, and you can see that it's higher. So alkaline is high and acid is low, okay? The normal range is 7.35 to 7.45. I know this is a review for you. So let's get started and talk a little bit more about this. Normal values, your normal pH is 7.35 to 7.45. So anything that's under 7.35 is considered to be acidotic. Anything greater than 7.45 is alkaline. PaO2, that means the partial pressure of CO2 in the artery. So if you see an A, the P just means that partial pressure. It's just a measurement. The A means arterial. The important thing to focus on here is the CO2, and the norm is 35 to 45. As for bicarb, or HCO3 bicarbonate, the normal is 21 to 28. However, you may see sometimes that it's 22 to 28. Okay, so that's your bicarb, and that's made by the kidneys, or retained or excreted by the kidneys. PaO2, again, that's oxygen. And so this is your normal oxygen levels. And we don't talk about them as much in this class, but it is important to know that the norm is between 80 and 100. So again, I understand that's probably a review, but we just want to start. This is kind of a starting at the basics. Okay. And then the next video that I'm going to recommend that you have a look at is from Ashley Viu from Cornwall campus. And I was chatting with Ashley today. She's another, and Steph actually in Kingston. They're both nursing patho instructors, so nursing application. And so I was just saying, I think it would be helpful to have a video about acid-base balance, and Ashley offered to share her video with us. So that is posted as well. So let's keep going and talk more about this delicate balance that we talked about in class. So when you think about the lungs, I hope that you think about oxygen and CO2. So when we think about CO2 as being acidic, okay? So anytime you have an increase in CO2, your pH is decreasing, which means your pH is acidic, okay? That helps you to remember lungs, CO2, acid, okay? It can get rid of CO2 if there's too much acid, or it can retain CO2 if it needs more acid. So if they're in an alkalosis, and we'll talk about what that looks like. So CO2 and water creates carbonic acid. So it's acidic, it's an acid. On the other side, you have the kidneys, and the kidneys can release or excrete or keep hydrogen. And you remember that something with a lot of the hydrogen ions, H+ is acidic. However, it also can retain or excrete through urine bicarb, okay? And if you think about bicarb, sodium bicarbonate is baking soda. It's not the same thing as baking soda. It has it in it. So sodium bicarbonate would be like Na, which is sodium, and then your HCO3. But it's kind of, if you think about, have you ever had a bug bite or poison ivy and you use baking soda on it? It's very soothing. It's very alkaline. So HCO3 is alkaline. So if you have a lot of HCO3, your pH, of course, is going to be more alkaline. It's going to be higher. So those are the two mechanisms that you have to really understand before you get into acid-base balance. And that really helped me to learn when I was learning it as well. So your H+ again is actually can make things acidic if it's high, or low could be alkaline. And then your HCO3 is that nice buffer. So that's the buffering system. Okay, now we're going to talk about acid-base compensation and kind of what that looks like. So we're going to start right at the top, and you can see your pH is here. You've got your low pH, which of course is acidic, so it's acid, it's low number. And when we have a low pH, it's acidemia, or you're acidotic, or in an acidic state. There's two types of acidemia. There's either respiratory or metabolic. So let's talk about respiratory first. Respiratory acidosis, you know that it has to do with CO2 because we talked about CO2, lungs, acid. You also know that it has to be increased CO2 because we know that the higher the CO2, the more acidotic the person will be. So this means that your PCO2 or PaCO2, however you want to say it, is greater than 45. So you have an increased amount of acid from the lungs for whatever reason. It could be pneumonia, it could be asthma, it could be pulmonary disease, it could be a CNS disorder like a brain injury where the breathing centers aren't working properly. So anything like that could cause that increase in CO2. The word that we use with increased CO2 is hypercapnia. So anytime you see hyper, we know it's more, larger, greater, whatever it may be. Capnia, you think of CO2. So hypercapnia is happening here. And so you have more CO2, you're more acidic. With, hopefully the body starts to kick in and compensate, okay? The only time that, and initially when we're up here on this level, level 3, this is an uncompensated value that I'm talking about, okay? So maybe they have a pH of 7.3, they have a PCO2 of 55, and they have a normal bicarb. So that's uncompensated. The body's not trying to kick in any way. When the body starts to try to compensate, then you get into this section here. So this row here. So what happens is we were just talking about the kidneys can either retain or get rid of bicarbonate or HCO3, and it can also get rid of or keep hydrogen ions. So the more hydrogen ions or H plus that's present, the more acidic it would be. So it's going to try to keep bicarb to try to balance out because that's alkalotic, and get rid of that H plus because it's acidotic. So in that case, you're going to see your bicarb is going to be high because it's like, uh-oh, we've got a lot of acid here. We need to buffer this out. So we're going to keep this bicarbonate. Okay, so that's the respiratory acidosis. It could be from things like pneumonia, asthma, bronchitis, CNS disorders, brain injury, that kind of thing, like hypoventilation, something like that, okay? Anything that's decreasing that. So now let's go to metabolic acidosis again. So we're still in acidosis, but this time it's metabolic, which means it's something going on with that kidney, okay? It could be also that the person is in diabetic ketoacidosis, a severe ketoacidosis, starvation, anything that causes an increase in those the H plus, the hydrogen ions, or anything that's just like getting rid of too much bicarb. We don't have enough of that alkaline substance, so they become acidotic. So what you're going to see is a low, because it's caused by the kidneys. Anything that's caused by the kidneys is metabolic. Anything caused by the lungs is respiratory. You're going to see a low bicarbonate because it's not neutralizing it. So what does the body do? The body's like, ooh, we're really alkalotic here, or acidotic here. So the respiratory system kicks in. And what they try to do, what the lungs try to do is, well, what do you think they do? Are they going to want to make more CO2? Or are they going to want to keep CO2 or get rid of CO2 if they're acidotic? And if we know that CO2 is an acid, they're going to try to get rid of, the lungs are going to try to get rid of CO2, okay? Because if we can get rid of that CO2, then we're going to have less acid. So what you see in someone with a metabolic acidosis is you see them hyperventilating. Those small breaths that we talked about, those deep, fast breaths, and you're going to see then your CO2 starts to decrease because you're blowing off the CO2. We don't want to keep the CO2, okay? We want to get rid of it. And so that's how it corrects. So again, it's like that buffer kind of back and forth. Okay, If we go on the other side, where we're in the land of alkalosis, we're greater than 7.42 is what this diagram said. It could be 7.45, so don't stress about that number. We won't give you questions that are right on the cusp. That wouldn't be fair. Sometimes lab values are slightly different. You're in alkalosis either way. So alkaline, your pH is high. Okay. Oops, this was supposed to be purple, but it's not. That's okay. So you've got high pH over here. Respiratory alkalosis. We'll start there because I've got my red. Respiratory alkalosis has to do with CO2 being, what do you think, low or high? If you said low, you're correct because it's an acid. So if you have low CO2, it's going to make you alkalotic. So your PCO2 is less than 35. And sometimes you see respiratory alkalosis with people who are like in like a real, the textbook says hysteria, which I don't really love that word, but like panic, hyperventilating, hypoxia can cause it. What else? Ventilatory settings. So sometimes we're giving like the ventilation when people have an endotracheal tube in. We give like a certain amount of breaths per minute. And sometimes if we're giving them too many breaths or too big of breaths, then we end up putting them into a respiratory alkalosis. And so what happens if it's a vent setting, we usually would pick up on that because we'd be doing frequent ABGs or arterial blood gases. But if not, if it's caused by something else, then what happens is the kidneys kick in, okay, at the bottom here. So with compensation, you have bicarb. Because you're alkalotic, the body's going to go, ooh, we should get rid of that bicarb. We're going to pee out that bicarb. They start to void it out because they don't want that alkaline substance. The other thing that the body does is they keep the hydrogen, they keep the H plus ions. Okay, so that's that. And then metabolic alkalosis is over here. So again, it's metabolic, so we know it's something going on with the kidney. Something's happening there. With metabolic alkalosis, you're going to see your bicarb is what's going to be high because again, if it's kidneys, it's bicarb. If it's CO2, it's RESPs. With a metabolic alkalosis, you're going to see, it could be from someone who's vomiting. Sometimes people who have too much aldosterone, certain diseases that cause too much aldosterone. What else did we talk about? Diuretics sometimes put people into a mild metabolic alkalosis, alkalosis, because what happens is like they're getting rid of all the electrolytes, they're getting rid of like sodium, potassium, chloride, and then they end up keeping too much bicarb. And so if there's anything that causes too much bicarb, it's going to make you be alkalotic, okay? So we see there's increased HCO3, and then for that one, again, the lungs are going to go, oh, you better help the body here. There's an alkalosis happening. Something's going on with our friend, the kidney. And what do you think happens? Well, we want to become more acidotic, so the body wants to hang on to that CO2. They're like, this CO2 is going to help us balance. So they start to retain CO2. How do we retain CO2? We hypoventilate. So we want to retain that CO2. And so if we breathe really slowly or shallowly, I don't think that's a word, but then you will have you'll be able to keep that CO2 and increase your CO2 to help with become more balanced. Okay, so that will increase your CO2 with a decreased rest rate. Okay. Hopefully I didn't say that backwards. You want to increase your CO2 and decrease your rest rate, so hypoventilation. And again, a few key terms to remember. Hypocapnia means low CO2. Hypercapnia means high CO2. So if you had a compensated metabolic alkalosis, what you would have would be hypercapnia, which means more than what we should have, more than normal amount of CO2. Okay, and I'm just trying to review some of the terms because we had talked about that today. So that is the overview kind of briefly, and hopefully this is helpful for you. I just wanted to do a quick video because when Ashley offered her PowerPoint, I thought there's no point in reinventing the wheel. She did an awesome job at it, so I'm going to post that If you have any questions about any of this, let me know. I think that's all I wanted to add. But just keep in mind that carbonic acid, CO2, and then your HCO3 is alkaline, and then your hydrogen ions, if you have more of them, it makes you acidic. So sometimes the kidneys will either get rid of them or retain them, depending on what's happening. Our slides do have some more information about like the metabolic alkalosis and acidosis, what the signs and symptoms are, but I just talked about these verbally as well. But this is here if you need it. You can take a little screenshot or whatever. And then your alkalosis is here as well. And again, I'm not going to go through all this because we just talked about it. But just thinking about metabolic is kidneys, and then the rest system's going to kick in, hopefully, and respiratory is respiratory, and the kidneys are going to do something to hopefully help it. Here's respiratory acidosis, and then I'll just scroll through the respiratory alkalosis so that you can see it. So hopefully that helps. If you do have questions, you can reach out. This is the example that we did during class, so you can work on that on your own as well. And if you want to check in with me to see what the answers are, I will check in over the weekend a little bit, and I will check my email, of course, on Monday as well. And here's another option for you, okay? So we don't focus as much in this class on compensated, uncompensated, that kind of thing. We're just looking at the patho. And I know you're doing that in other classes, but again, if your pH is normal, you know it's compensated. If your pH is abnormal, but something's trying to compensate, it's partially compensated. And if it's like the questions that we were looking at earlier, then it's completely uncompensated. Okay. So that is that. Thank you for watching. I hope this was helpful for you. And it's really important that you find a way to learn that works for you. There's the Rome method, which is respiratory opposite, metabolic equal, or there's tic-tac-toe, or there's just, if you would rather kind of visually think about it, depending on how you prefer to learn. So that's it. That's all. Thank you for watching. Okay, bye.